Welcome to another video. In this video, we will continue learning mental health nursing starting with bipolar disorders. It's important to know that there are two types of bipolar disorders. There are type 1 and type 2. Bipolar disorders are known as mood disorders. Bipolar 1 is characterized by at least 1 week-long manic episode. Manic episodes may alternate with depression. Bipolar 2 is a low-level mania that alternates with more depression than bipolar 1. Let's cover what manic characteristics are. A person with bipolar disorder will have an inflated sense of self-importance, extreme energy, excessive talking with pressured speech. Other behaviors include indiscriminate spending, reckless sexual encounters, and risky investments. Note that a person with bipolar disorders will first have the mania phase followed by the depression phase. They will go through a high and get a low. Signs of mania include the patient displaying the following: becomes angry quickly, delusional self-confidence, constantly pushing limits, manipulating, and finding fault, euphoric with intense feelings of well-being. Now, once their manic phase is over, here are signs of the depressive phase. The patient may do or be the following: increased or decreased appetite, decrease in activities of daily living, decreased emotion and physical activity, easily fatigued, inability to make decisions. As a nurse, how do we care for patients with bipolar disorders? Here are the following interventions. Safety is the #1 concern for patients with this mood disorder. It's important to assess whether the client is a danger to self or others. It is very important to remove hazardous objects from the environment. Assess the client closely for fatigue. Assess the need to protect the client from uninhibited behaviors. Assess for coexisting medical conditions such as substance use disorder, as this can make their condition worse. Now, let's say your patient is starting to become aggressive towards you or a staff member. What is one intervention you would do? Here are 2 interventions you could use. Encourage the client to talk out instead of acting out feelings of frustration, and assist the client in identifying feelings of frustration and aggression. Now let's talk about medications. The common medications used are the following: mood stabilizers such as lithium, anticonvulsants as is valproic acid, atypical antipsychotics such as aripiprazole and risperidone, anti-anxiety agents such as clonazepam. Well, that's it for this video. In the next video we will continue the lesson by learning about personality disorders. Please like and subscribe so we can create more videos. Thanks for watching.